Hey, this is Dr. John Fott with Firehouse Animal Health Center. Today we're doing an instructional video on how to give subcutaneous fluids at home with spicing. There are three things you're going to need for that. We need a bag of sterile fluid. We tend to use what's called lactated ringer solution. There are other solutions out there. You need an extension line that will plug into the bag and help drip down to the patient. And we need a fresh needle for this. So what we do first is take the bag, hold this end up, unplug the cap, and then we need to put our line, insert in, which breaks a seal and allows the fluid to flow. So now our bag is set. There's a break here that you can clamp off the line, and just need to remember to open that up when we start flushing. So I'm going to hang this up here. The other end of our unit consists of an end that we just need to take plastic cap off. And we're going to open a fresh needle and put right on the end, and this has a lure lock so it tightens and locks into place. So we want to run the fluids until the fluid runs all the way down through the line. So we're going to turn that on, and now we have fluid flowing through. So I'm going to close it off again. Now we're ready to go towards the patient. With the patient in mind, we want to try to keep them calm and comfortable. If you have an extra set of hands with the person, that's oftentimes helpful. We want to find loose skin, so usually over the shoulder blades. And so, let's see if we can do this without making spicy too mad. We want to grab the skin, pull it up away from the rest of the body, and then take the needle at a 45-degree angle down in under the skin. Importantly, you don't want to push through the skin sideways and go out the other side. So we're going to pull this up, take the needle right in under the skin. Now the needle is under the skin, so we're going to hold this in place with one hand and turn our fluids on with another. And you'll see that the fluids are flowing in. Your doctor should give you an amount of fluid that they want to be given at each individual time, because it varies based on patient weight and how often we need to do it. But we're going to run the fluid. The higher you hang the bag, the faster it will flow. You also can put some gentle pressure on the bag to squeeze and allow it to go a little bit faster. But once you're done, we close off the line here so the flow rate stops. We're going to pull gently, pull the needle away. Sometimes you'll have a little bit of leakage at the injection site. If you just put some gentle pressure for a few seconds, that should help close that off. And what you'll notice is that oftentimes there will be a pocket of fluid under the skin, but that's okay, it gets absorbed, and that's how we give subcutaneous fluids.